I am Dr. Sharjeel and you are watching my YouTube channel, and you are now watching challenging cases playlist. I presented this challenging case few weeks back, and most of the viewers they correctly diagnosed it as a case of herpes simplex epithelial keratitis. This challenging case was a bit easy because I showed you one of the most common and most important corneal diseases that comes to the eye doctors. Now, HSV can affect eyelids in the form of blepharoconjunctivitis, cornea in the form of epithelial and stromal keratitis, anterior chamber in the form of iridocyclitis, and retina in the form of retinitis. Usually it is unilateral, as in this patient. Now this young 25 years old male patient presented to me with decrease of vision, discomfort, mild discomfort, watering and photophobia. On examination, you can see there is something on the cornea, but the signs were not severe. You can see I am performing with a cotton swab, checking corneal sensation, and corneal sensation is also decreased. So diagnosis is clinical fluorescein stained dendritic epithelial keratitis, and corneal anesthesia. They point towards classical dendritic epithelial herpes simplex keratitis. Now I made this video because you can see that the classical dendritic branching pattern is evident when you have seen many cases. Even on a routine slit lamp examination, you can identify the dendrites, but fluorescein staining will further enhance it, as you can clearly see here. And recurrent activation, usually the primary HSV causes blepharoconjunctivitis, and recurrent activation causes corneal lesions in the form of these dendritic branching patterns, and further recurrent episodes cause corneal scarring, corneal opacification, decreased corneal sensation, and loss of vision. Now, risk factors to develop HSV infection are exposure to sunlight, fatigue, stress, trauma, heat, menses, trigeminal nerve manipulation, and any type of immunosuppression. Diagnosis is clinical, and these dendrites, they represent the active replicating virus. If you put such patients on steroids, the branching pattern of the dendrites evolve into geographic ulceration. Patient may also present with marginal keratitis. Now treatment is with the topical antiviral ointment 5 times a day for 2 to 3 weeks. You have to follow the patient every week, and you will see a rapid improvement. After ointment, epithelial debridement of the dendrites may also help reduce viral load. Usually topical antivirals plus sometimes for super added bacterial infection, topical antibiotics are given, and that is enough. Oral antivirals can be used as a prophylaxis to decrease the chances of future recurrences. That is also proven by research studies. So that was a classical case of HSV dendritic keratitis, and I thought I should share with my viewers, and I hope you, after watching this video, you will also be able to diagnose and treat it. Thank you very much.